Hello Health on LAE is presented by the Ochsner Health System, a nonprofit, academic, multi-specialty healthcare delivery system dedicated to patient care, research, and education. The Ochsner Health System includes 7 hospitals and more than 35 health centers located throughout Southeast Louisiana. Ochsner, healthcare with peace of mind.
We call it our More Money to Spoil Our Grandkids plan. With a Humana Medicare Advantage health plan, we get tips on how to make our money go further. We even get a health finance and benefits statement called Smart Summary that helps us find even more ways to save. And we like more.
More of what you want, because you deserve more.
Hi, I'm Tom Bagwell, and welcome to Hello Health. LAE is proud to be partnering with the Ochsner Health System and Humana to bring Ochsner's Hello Health weekly education and information series to television. Tonight, the prevention, detection, and treatment of sports injuries. Our guest is orthopedics and sports medicine expert Dr. Deryk Jones. Well, tonight's guest earned his doctorate of medicine from the Stanford University School of Medicine. His bachelor's in science and philosophy are from Emory University in Atlanta. He completed an internship in general surgery, Brigham and Women's Hospital. His residency training in orthopedic surgery took place at the Harvard residency program in Boston. He also did residency work at Massachusetts General. He completed his fellowship in sports medicine at the University of Pittsburgh. His first job in New Orleans was with the Department of Orthopedic Surgery at Tulane. He has served as the team physician for the basketball teams at Dillard, Suno, Xavier, and for the New Orleans Brass Hockey Organization. Oh, the days. Today he serves as the team physician for the New Orleans Saints. He continues to do research work in the following areas: cartilage metabolism and regeneration, bone tendon healing, and softball and baseball mechanics. He has extensive experience in arthroscopic ligament repair and joint replacement, and he is involved in policy decisions concerning sports medicine at the national level. It is our pleasure to welcome Dr. Deryk Jones to Hello Health. Great to have you with us on the program.
Thank you for having me, Tom.
Thank you for being here. Well, what was it or who was it that first got you interested in the field of medicine?
Well, I actually was a patient. I actually tore the ligament in my right knee when I was playing soccer in high school. The gentleman who fixed me up, Dr. Henderson from Tallahassee, Florida, was able to put the fascia lata, which is a tissue on the side of my leg, and recreate a ligament in my knee. I thought that was just a neat thing to be able to do, and I thought that would be a great field to go into.
Did it help your game any?
No, it actually hurt my game initially, but then later on I was able to play soccer at Emory. And so I guess it worked out pretty well.
We didn't mention Michigan in any of the introduction, but you were actually born in Detroit, right?
I was born in Detroit. My father moved down to Tallahassee, Florida when I was 9, and so I got a taste of the North and the South there.
Okay. You played as a child, and now you have 3 children of your own, 7, 9, and 17.
Yes, sir, I do, yeah.
Any of them involved in sports?
Yeah, soccer, basketball, dance. They actually are involved with me in karate, believe it or not, as well. So we're all doing a little bit of everything, but they're actively involved, yes, sir.
And at least one of them, to this point, has an interest in medicine.
Yeah, little Deryk, he says he wants to be an orthopedic surgeon, so we'll see. He's got a long way to go, but he's a smart little kid, so he might just do that. I think he will.
That is great. Well, I'm sure they are Saints fans, as most of us who live here are, and you are the team physician for the Saints. So I do want to talk a little bit about that tonight. I do want to let our viewers know, by the way, we can't talk about specific injuries with specific players due to confidentiality agreements between the Saints and Ochsner, and obviously Dr. Jones. And as he mentioned to me earlier, we don't want to talk about your knee, so we're not going to talk about Reggie Bush's knee, and we just have to understand that. And obviously winning is of most importance. That's right. So we'll respect that tonight. But what role do you play as the team physician for the Saints? What does that job entail?
Well, we diagnose the injuries. We then figure out the plan of treatment. We then help the trainer in implementing that plan. The trainer does a lot of the work. We help them, in determining surgical versus non-surgical treatment options, whether medications are needed, required, what type of medications would be best for the player, what contraindications to different types of medications may be applicable to certain players versus other players, and what timing to get them back to sporting activities and full-level professional sports.
And in general, again, not talking about any specific player, the decision to get a player back on the field when that timing is right, who makes that decision? Is it the team physician? Is it the trainer who's there day to day? Is it the player? How much impact does the player have in that decision? And obviously the coaches play a role there as well.
It's all the above. We all give our input, we put our heads together with the players' full knowledge of what's going on. They have the final say, so obviously it's their body, their decision, but we give them the most educated ability to make that decision without harming themselves and getting them back in there. Obviously we take into account the situation the coaches are dealing with, general managers are dealing with, the trainers are dealing with, so we all come together. So it's not just one person, it's all of us together.
Does it help you in your role that you are an athlete? As you mentioned, you're, at least at this point, taking karate with the rest of the family.
I call myself, I used to be an athlete. Like a lot of people we were talking with tonight.
Better than never was an athlete.
Exactly, tried to be one. So yeah, I actually, it does help, and it helps that I was a patient, more importantly, because I realize what it's like to be at a high level, have it taken away from you, and then want to get back to that level. And I understand what players are going through and what athletes are going through to try to get back out there. So
all right, let's move on to tonight's topic. If you look at the statistics, it is easy to see why the field of sports medicine has grown so considerably. Let's look at those numbers, and troublesome in many ways.
Yes, it sure is. It sure is. We have large numbers of athletes who are injured per year. If you look at the statistics, about 775,000 people under age of 15 are injured per year. 80% of those injuries are in our typical sports: football, basketball, soccer, baseball. But 2/3 are generally, minor sprains and bruises. 5% can be, broken bones, and another percentage can be some high-energy ligament injuries as well. So,
does this mean more children are playing, or does it mean that they're not being as safe as they used to be?
It means more children are playing. Actually, the injury patterns are actually in our favor. We actually diagnose them earlier. We're not allowing catastrophic injuries to occur, not allowing people to go back out with situations where they're at risk for catastrophic injury, but the numbers are larger, so that's why the numbers are increasing.
Are you finding that coaches are more educated now, especially at the playground, school level and playground level, where there isn't a team physician or a trainer, a head trainer on the sideline?
They're more educated at all levels. I think there's much more information out there through the internet, through education, through programs like this, that allows people to understand when it's potentially risky for a player, a young player in particular, to get back out there and try something versus allowing them to heal up and get back in there. And there's always typically trainers now in all football games at the high school level, not at the middle school level, but the high school level, absolutely. And so there's lots more information, lots more knowledge out there. I think coaches are much more educated about when to not harm someone.
What are the things you look for, doctor, when detecting sports-related injuries?
Well, typical things you look for are deformity, bruising, swelling, loss of function, such as limited range of motion, inability to resist against a strength assessment for muscle injuries, ligament injuries. So typically those obvious gross deformities.
And there are going to be times where you don't see anything, but it would be most important for a player to communicate to either his coaches or to his parents that there is an issue. How much do you rely on the feedback you would get from the athlete?
That's the most important thing. The history really directs you to what you need to be looking for. So it gives us a starting point. If someone comes in and says, "I don't know where I hurt," it's kind of hard to figure out what to look at. So we typically take their history, what the length of time, the numbers of injuries they've had in that body part, any family history that might be contributing to those type of things, and we use those all together with our other objective findings such as X-ray, MRI, physical examination to then come to a conclusion on the diagnosis.
Very good. The next area we want to discuss in detail is fractures. Is there a difference between a fracture and what we commonly refer to as a broken bone? Can a bone be partially broken rather than a complete break, and does that make a big difference in the healing process?
Absolutely makes a difference in the healing process. If you have a broken bone that's completely disrupted, then there's a lot of soft tissue injury that goes along with it. Sometimes it can actually break through the skin, and that would certainly be an issue in terms of limiting healing potential later on. There can be small breaks. Broken bones and fractures are the same thing, but there can be stress fractures from overuse-related injuries. You can have a cortical break that's not recognizable by looking at the person, but by x-ray we can find it. And certainly those fractures can be use-related type injuries, so they can heal quicker if you allow them to heal and prevent the person from doing that repetitive activity that causes it, versus the obvious broken bone where you have to splint, cast, or plate that type of fracture to get it to heal.
Myth or fact, a broken bone once healed is stronger than the bone was before? Something I've heard, but I don't know if it's true or not.
In certain situations, that can definitely be true. If the person lays down a lot of new bone and there's a big thing called a callus that forms, then that bone can actually be stronger than it was before. So that is something that can happen.
I know people who have broken a dozen bones in their body, and I know who are athletes, and I know others who have yet to break a bone in their body who are athletes. Are some of us more prone to fractures?
Absolutely. There's definitely a genetic component we're not smart enough to know about yet, and there are genetic conditions that lead to high rates of fractures. So that's definitely known out there, but we're not smart enough to know which individuals that are quote-unquote normal are at higher risk than others. But if a person has repetitive fractures, that means their bones genetically are probably more brittle, weaker than some other persons. And there's usually a screening process as people tend to go through the different levels of athletics. By the time they get to the professional level, most of those guys have pretty strong bones.
We would be remiss if living in South Louisiana if we didn't talk about the heat and the components there and heat-related illness. And I know you have a lot of information to share with us in that area tonight. Yeah,
heat obviously is a big condition down here in the South. We have a lot of different ways to determine whether someone's going into heat stroke or not. It's a common pediatric sports injury, and certainly thousands of emergency room visits per year occur as a result of that. It's the third most common cause, actually exercise-related death in the United States, believe it or not.
Let's go through some of the signs of heat-related illness, and again, quite a few of them to share.
Very important. Yeah, very important to know the early signs. Cramps is obviously something people know about, but a very high body temperature is an indicator that person may have some heat-related problems. Their skin can be very red and hot. Dry skin is very worrisome. That means they're not sweating appropriately. Heavy sweating, profuse sweating can be a problem as well. Rapid pulse means that the blood flow issues are not intact, and they can have a headache, throbbing type symptoms as well in their cerebrum. Dizziness is one, nausea, vomiting, confusion. Loss of consciousness is one that can occur, and that's obviously very worrisome. Paleness in the skin, all these issues are symptoms that we should be aware of when we see someone who's having a heat-related problem.
You work with the Saints, so if it gets too hot, they just move it indoors.
Yeah,
not an option for most high school programs.
That's right, that's right.
Let's talk about something else we've heard over the years, no pain, no gain. Obviously, there are coaches who won, and you were an athlete, so as a coach, you want players to battle through and fight strong, and all that leads to good conditioning. So when you get to the fourth quarter and you need that last drive, you're going to be there. And obviously, there's a lot to be said for all of that.
There is.
However, on the other hand, we've seen athletes actually die in practice. Corey Stringer comes to mind, of the Minnesota Vikings is one. So you mentioned that we're all smarter and more educated today. What advice would you have for coaches who may be watching about the importance of building conditioning and fighting through the tough times, yet keeping safe?
Well, I think you have to recognize those athletes that aren't well conditioned in the beginning of the practice. If the first practice of the season, do a time trial, assess who's in shape and who's not, and then after the practice, address them directly and tell them they need to work on some things and get ready for what's coming. And recognize that person's not going to be able to maybe take as much of a solid practice as other players during that same time period. You can work them back into it slowly, but you have to take that into account. I think it's also important for them to have plenty of fluid available and recognize that hydrating should be done before the practice as well as during the practice, and allow those times to hydrate to prevent any heat-related illness. So you've got to realize that no pain, no gain is definitely there, but at the same time use your knowledge of the player's problems, their injuries, their physical condition help guide you in terms of preventing someone from getting, a real big problem from developing.
The other point we should probably make is conditioning nowadays is a big change from yesteryear too, is year-round.
Yeah.
My son plays lacrosse at a local high school, and yes, there's a lacrosse season, but 3 days a week he was lifting weights and working on conditioning, and this was in the off-season. So
right.
Rarely do you get to the beginning of a season having done nothing. Is that a big difference too?
That's a huge difference, and I think that's one of the things I tell parents. If you think a child's going to be trying out for a soccer team in September, for example, don't wait till September to start getting them ready for it. Take them out to the field, run them around a little bit, get them used to playing a little soccer, kick the ball around every Sunday or something, Sunday afternoon, but start working them back into shape. Don't allow them to sit around and play Nintendo all day long, watch TV all day long, and then expect them to jump out there and be, the star in September. So you have to work them back in slowly. Usually 3 to 4 weeks is a good period of time to start working on that. 3 to 4 weeks before the season starts is a good, reasonable period of time to start working on something like that. Obviously, all year long would be great, but if they haven't been doing that, at least 3 to 4 weeks before that exercise starts.
We're going to talk about hydration and pass along some tips in just a moment. But first I want to ask you about the physical. Today, almost every student at the high school level, I'm not so sure at the playground level, but certainly any high school athlete has to take a physical.
Yes, sir.
How important is that? And in a physical, what are you looking for? And can you catch everything?
You can't catch everything in a physical, but once again, as I was saying before, the history is the most important thing. So when we do a physical, we first ask them, have you had any injuries, any family history of any problems, anything we should be concerned about? Are you worried about anything? Is anything bothering you right now? So we can direct our physical, our specific exam, our sport-specific exam to that body part. I'm actually, as we talked about at the national level, we're involved in the pre-participation physical examination brochure that comes out every year. We wrote the 4th edition just recently that's come out. And that actually goes over some of the criteria that we look for, both cardiovascularly as well as on the musculoskeletal side, to assure that people don't have injuries. I think it's very important, though, for a physical to be performed prior to each sporting season. Some states actually don't do it every year. That may not absolutely be necessary every year, but at least twice during a 4-year high school career, I think a player, athlete should be able to have a physical to make sure there's no injuries, especially as they mature from pediatric age, 14, towards that adult age.
Let me give you a specific. Would one of the questions be about a family history of heart disease?
Absolutely.
And if you got that information as part of the physical, would your examination be any different?
Absolutely. I typically don't do the cardiovascular examination, but the physician who would be there doing that examination would certainly be listening for any murmurs, any signs of cardiomegaly, a widening or enlarging of the heart. And so certainly those things would lead us to be more concerned, possibly order an echocardiogram, EKG, to further evaluate for possible signs of a bigger problem that could lead to cardiac death.
All right. We do want to talk about, though, very quickly, the difference between children and adults exercising. And you'd be surprised there are differences that we need to know about.
There absolutely are differences. When you look at children, their body area is obviously smaller. What that allows for us, the heat to do, is to evaporate more fluid from their bodies quicker than a larger person. They're also closer to the ground. So by being closer to the ground, they're actually closer to the radiant heat that comes back up off the ground, especially on certain surfaces, tar surfaces or false fields can generate a lot of heat, so they're closer to that situation. There's also less body area for them to lose, so if they lose a lot of fluid, they can certainly go down tubes pretty quickly.
We've heard the controversy over artificial turf, and certainly there's a new generation of artificial turf that much more so mirrors real grass. Any thoughts from what did you say, once was an athlete to someone who has an athlete now, who works with athletes as a professional?
Yeah, I think some of the surfaces out there, there's some concerns with some of them. There's studies being done right now where we're trying to assess for torque ratios and the ability of these substances to give, and whether that actually contributes to ligamentous injury. So we're not sure yet whether that's a contributing factor or not. Certainly the condition of the field needs to be maintained if it is one of these artificial fields. I've seen some artificial fields which are no more than a cement slab with a little carpet on them. That's a problem, obviously, and that leads to injuries, bruises, broken bones. So you have to be concerned about some of the fields that are out there. But typically these false fields that are coming out now, they try to take that into account, and they're coming out with different substances all the time. So we're looking at it, something we're still evaluating, though.
Very good. Well, the good news is there are things you can do to reduce your chances of heat-related illness on the field, and let's talk about those. You brought along some great hydration tips.
Yeah, it's always important to never wait until you're thirsty when you're talking about trying to hydrate. So you want to start to drink before the actual event. That's why I encourage people to drink 30 minutes ahead of time. If you're thirsty, you've already lost 1 to 2% of the fluid content that you should have had before you started exercise, and then you're going to be susceptible to these heat symptoms we talked about before.
Very good. Can you give us is body size a determining factor on how much you should be drinking before the game and maybe during the game?
Yeah, absolutely. Some studies have shown that people less than 90 pounds should drink approximately 5 ounces every 20 minutes. If you're greater than 90 pounds, you can actually go up to 8 ounces every 20 minutes. So you really need to take into account the body mass of the person. Larger individuals need to drink more fluids. It's a very common sense thing. People don't think about it enough, though, and they definitely need to obviously hydrate before they start the practice as well as during the practice at the appropriate level.
I know the marketers at the University of Florida would like us to think that Gatorade is what has won them national championships here over the past couple of years. We'll have to see what happens this year. Give us your best advice on water versus Gatorade or other sports-related drinks.
Yeah, actually, you know, it used to be a myth that water was the best thing to do, but there actually is data to show that fluids with electrolytes in them help replenish you better than actual just plain water. When you're dealing with pediatric populations, they like a little flavor to it as well. They'll put more down, they'll drink more fluid. You can actually use a helpful hint, and just dilute 1-to-1 any drink you're concerned about. Things you want to stay away from, though, are caffeinated drinks, things with a lot of caffeine and carbonated drinks. They don't do much to replenish the fluid content we need for athletic activities, don't replenish any of the electrolytes, and also make you go to the bathroom, urinate, and that loses fluid as well. So those are all things that are counter to what we'd want to do with hydrating.
Well, football is a great sport, one of my favorites, but it is a dangerous sport. And let's talk about injuries to the spine and how they are diagnosed, first of all.
Okay. Well, obviously, if someone has a painful neck, I as a physician on the field or anybody on the field should be concerned about that athlete. Certainly, there can be catastrophic injuries that can occur with a fractured spine developing. So things we look for are numbness, paralysis, inability to move their legs or arms, numbness and loss of sensory feel in the extremities. The typical injury pattern for a catastrophic cervical or spine injury is a flexion injury. So the person had their head down, particularly in football, when they should have been looking up and seeing the numbers. I always tell the athletes, you have to see the number if you're going to make the tackle. If you don't see the number, you put your head down thinking you're going to protect yourself, you're actually causing a potential harmful or catastrophic injury to your neck.
NFL just made a rule change which says you essentially, I don't know what the official wording is, but you can't blast a player when he doesn't see it coming.
It's a preventable injury, and they're trying to prevent these high-level athletes from damaging themselves and the other athlete. And as I see these catastrophic injuries on the field, I look at all the players around me, and players on both sides of the field, both teams, whenever it occurs, always do the same thing. We all pray. We all think of the player's best interest. So I think everybody's on board with that.
Knowing, of course, they could be the next one.
That's right.
Well, NFL, colleges, and most high schools have a trainer on the sideline, an ambulance at the ready, probably a physician there somewhere, team physician, or certainly one in the stands. It's the playgrounds where we see most of the worry and concern. Let's say on a playground there's a football injury where the player is down and not getting up. What advice do you have for the parents, the coaches who are there, where there may not be a physician on site?
Well, first thing that people want to do is try to flip the player over and take a look at them and look at their eyes, and that's the last thing you want to do. You don't want to flip or roll the player over. You never want to take.
They're on their stomach.
Yeah.
Leave them on their stomach.
Leave them on the stomach. If their helmets are on, leave the helmet on. The straps on, leave the strap on. The reason being, if you make those subtle movements, you can actually cause catastrophic injury to the spinal cord, whereas it may have been a partial paralysis. It can become complete paralysis just with that simple move. So you don't want to log roll the patient without having someone stabilize the neck and the body and roll the entire body and neck together. So that's the important thing. You don't want to torque the neck in any way that when it could be a potentially unstable situation. You don't want to do that. That's what can damage the neck and the nerves in the neck.
Would it make the most sense then to call 911 and get an ambulance there on site, or at least wait until a physician arrives?
Yeah, have someone who's skilled, a trainer, someone who's skilled in moving that player there. You can sit down, lay down by the side, talk to them, comfort them, make sure, try to keep people away from them, make sure they're breathing, but rolling them over and jumping in there and starting to do things, no, I wouldn't recommend doing that unless you were skilled and trained in that.
You bring up a great point. When a player's injured, everybody's hovering around. You're trying to get the player some air.
Right.
Back up. You can have the circle of love, but just back it up a little bit.
Everybody's concerned. Typically, it's a friend who's concerned, and they'll grab the player and roll him over, and that's what there's a neat video showing that happening, which is terrible, and it actually caused a problem in that player. So you don't want to do that. You want to leave them alone. Even though you want to help, if you don't know what you're doing, don't do it.
Finally, some advice from Dr. Deryk Jones on what to do after the game and after the injury. You've got some tips to pass along there.
Yeah, I think basically what you want to do is rest. I mean, cooling down is important. We all know about when we work out. There's that on the exercise cycle, for example. There's a cool down period. Well, it's for a reason. If you just jump right off the bike, remember how you feel. Your legs are very stiff. You're sweating. You're tired. You might pass out. What you want to do is slowly cool down and allow your body to recover, and that's what the cool down is supposed to do. So continue to work out, but allow the body to recover from that. Always rest. Never rush back. Particularly after an injury, never rush back before you've allowed your body to heal. Get some medical attention, try to get stretched out. Hamstrings, injuries, things like that require a little time to get over, so give yourself time to recover.
And probably communicate with the coach.
Absolutely.
If the coach thinks you're sitting it out and you're not really injured, again, that goes back to that player-coach communication. Yes, sir.
Very important. Very important to talk to the coach, have a good communication with your coach. Shouldn't be afraid to tell the coach there's a problem if there's a significant problem, and hopefully the coach listens to you.
Well, Dr. Jones, we thank you for the education and information you have provided us, and with football season right around the corner, keep our team healthy, would you?
Yes, sir. Thank you very much for having me.
All right. Thank you,
thanks, Tom.
Dr. Deryk Jones. Well, here's a look at what's coming up later this month. On Monday, August 17th, Doctors Laura Langefels, a family medicine physician, and pediatrician Daniel Bronfen will join me here on LAE to talk about your family's health and creating a partnership with your physician. That's Monday, August 17th. On Wednesday, August 19th, electrophysiologist Freddie Abisamra will be in Baton Rouge at Mansour's restaurant to talk about the seriousness of fainting. On Thursday, August 20th, anesthesiologist Tarun Jolly will be at the 4 Points Sheraton in Metairie to discuss current therapies for the management of chronic pain. On Monday, August 24th, we will be on the road at Oxnard's new Baptist Hospital. We'll take you into the new emergency room and talk with the CEO of Oxnard, Dr. Patrick Quinlan, and 3 doctors who were at the Baptist campus almost 4 years ago. We'll look back at their Hurricane Katrina experience, but more importantly, look ahead to lessons learned and to the rebirth of the Baptist Medical Facility. That's Monday, August 24th, here on LAE. And finally, on Wednesday, August 26th, cardiothoracic surgeon Abbas will be at Ralph's on the Park to talk about esophageal reflux and cancer. Now, to make an appointment with any Oxnard physician, including Dr. Deryk Jones, our guest tonight, or to learn more about upcoming Oxnard Hello Health seminars or to register for our seminars, you can call 504-842-5669. That's 504-842-5669. That's a special number just for this program. As a reminder, you can re-watch tonight's presentation or any of our Hello Health programs on our website at WLAE.com or on Oxnard's website at oxnard.org. Just type Hello Health in the search areas. Our thanks again to tonight's guest, Dr. Deryk Jones, to Oxnard and Humana for making this program possible. And our final thanks, as always, is to you for your support of this program, Hello Health, and our station, LAE. More than television.
Hello Health on LAE has been presented by the Oxnard Health System. 600 physicians in 80 medical specialties working with a team of more than 10,000 employees to provide nationally recognized healthcare across Southeast Louisiana. Oxnard, healthcare with peace of mind.
I call it my I've got a healthier plan. With the Humana Medicare Advantage Health Plan, I get more health and wellness options like fitness programs, health management classes, and a 24-hour nurse line. I can even talk with a Humana MarketPoint representative whenever I need to.
More of what you want, because you deserve more.